everything that you need to know about pelvic organ prolapse from a doctor of pelvic floor physical therapy and a mother who is living with pelvic organ prolapse herself. Hi, everyone. My name is Dr. Kaylee Zimmerman. I'm a pelvic floor physical therapist, and I'm the owner and founder of the Hope Doctors Pelvic Floor Physical Therapy in St. Petersburg, Florida. We are so excited to be launching so many online things and lots of different options. We're about to come out with a group cohort for pelvic therapy, which is super exciting. My son here, Bryce, my pride and joy, also my boss, so I'll say that. But I want to talk about prolapse specifically. I'm sure that you all see pelvic organ prolapse like talked about a ton. I'm sure that you've actually seen a lot of my videos are around prolapse, and part of that is because I live with it myself, and it is a part of my specialty. So I have extra training to become a specialist in pelvic floor treatment for pelvic organ prolapse. And so first and foremost, I think there is a lot of like misconception around the fact that when you have prolapse, a lot of practitioners, a lot of fitness influencers, a lot of people are going to say they can cure it. It's not something that's cured. It's not something that just goes away, because what happens is it's damage to the fascia. It's not damage to your organs. So if you have bladder prolapse, your bladder is not damaged. Your rectum is not damaged. I'm recording. Your uterus is not damaged. What's damaged is the fascia that holds it up. I always explain it to people like if you have TheraBands or stretchy bands to each corner of a ceiling and a big ball in the middle, as that ball gets heavier and heavier, and as gravity does what it does, those bands are going to stretch more and more, and the ball is going to come down. That's a good descriptor of what prolapse is. The ball doesn't change. It's the stretchy bands, right? Like they get more lax, they get more length in them. There's gravity, there's pressure management. There's all these different things that are contributing to that ball coming down a little bit more. And so organs are totally fine. But what is pelvic floor prolapse, right? Like, what is pelvic organ prolapse? And it is the dropping of the organs into the vaginal canal or outside of the opening. And so you can have that with your bladder, you can have that with your uterus and cervix, you can have that with your rectum. And if it's a rectocele or the rectum actually falls into the back wall of the vagina. You can have a rectal prolapse. That's a different thing. That's where it actually comes out through the rectum. And so those different organs can move down towards the pelvic floor. Things that contribute to a higher risk of that: vaginal delivery, yes, of course, right? Like if you think about the pressure of birth, nobody wants to talk about it, but vaginal delivery and vaginal birth can increase the risk of pelvic organ prolapse. There's also a couple other things to consider. If you have this in your family, let's say your mom, sister, grandmother, great grandmother, let's say they all have some form of prolapse or have had prolapse surgery, you might be at a higher risk. Let's say you have hypermobility or Ehlers-Danlos syndrome. That puts us at a higher risk because of the loss of connective tissue control, and also because we're a lot more likely to have descending tissue or lengthening of the tissue without the ability to contract it back up. That's going to put us at a higher risk. Super heavy lifting, chronic constipation, chronic pushing. And when I say vaginal delivery, let me talk about that too. That more so is with like forceps, vacuum assist, or if you're in a pushing phase for a long period of time. It doesn't mean everyone's at risk for it, right? There are just different risk factors. And so I like to always talk about that, because I think the expectation, like when I do a labor and delivery session with clients, I educate them on pelvic organ prolapse because it's possible that it might happen, which leads me into what I want to talk about next is how do we stage it, right? So first and foremost, we have to determine which organ is coming down, what that contributing factor is. Secondly, we want to determine like what stage it is. And so a really good pelvic therapist is able to do a very thorough pelvic organ prolapse examination. I'm really good at this, right? Because this is like one of my favorite things to treat, because again, I live with it. I went with the wrong diagnosis for several years, and I finally was able to get into the extra education and training that I needed. So what we do from there is we're staging how much movement is happening, right? We do it based on measurements. Again, it's a great clinician, they have a little stick that's called the POPQ stick, and they're taking measurements. They're measuring different levels of pressure. They're measuring reflexes. They're having you bear down. They're having you stand up. They're bringing knees to chest. They're getting you hands and knees. We're moving positions, and we're asking you to add pressure to the area so that we can get a really good accurate cue. I also like to do a standing assessment for prolapse if a client is not able to bear down or is afraid to in supine, because you feel most of your symptoms in standing. It can be really helpful for us to see that in standing. So, going back to the staging, stage one, or noticing a little bit of movement. I won't go into the numbers here because most of you watching are probably living with prolapse or a potential client, not actually like a practitioner, but I'm happy to go into that. If you want to comment below, I will send you all the information about how to read a POPQ stick. But when you're looking at a level one or a stage one, what that means, I always tell clients, like, that means you're actually pretty normal. Like, what they have now finally classified that a level one prolapse or a stage one prolapse is considered normal. We all have a little bit of a descent after a vaginal, not all, but a lot of us have a little bit of that descent of the bladder or rectum, whatever it is, after vaginal delivery, if we have connective tissue disorders, like those kinds of things, right? So a level one, stage one, fairly normal. Stage two and three, that's where we really want to know, what is your pelvic floor therapist doing to help you manage those symptoms? And are they telling you that it will go away? Because I have a problem with that, because it won't exactly go away. However, I have a stage two cystocele, stage two bladder prolapse, which means that the bladder is coming to the opening of the vagina. I can see it, I can feel it with certain things, and I have a stage one uterine prolapse. I don't feel it. I actually don't notice it's there except when I'm super constipated or when I'm doing really heavy lifting and on day 1 and 2 of my period. That's the only time that I start to notice that like tampon feel, that pressure, that heaviness. And so know that that's possible, but I know that it's still there. It didn't go away anatomically, but the symptoms were able to be managed. And that's the whole goal with pelvic therapy, okay? So, stage two and three is still pretty beneficial for pelvic therapy, but pelvic therapy is not Kegels. You should not be going in with pelvic organ prolapse and being hooked up with a biofeedback machine and watching a screen. You need to be doing exercise. The best thing that we've seen for managing symptoms: pressure management, which is how to breathe, how to contract the core, how to lift the weights, going over form, making sure we're there, posture, and strength training with weights. So you have to have a provider who understands those three things and is able to implement that. That does include, again, a full head to toe assessment. How are you landing with running? How are you landing with jumping? And that leads us into two, like, treatment for physical activity should have strength. You should be lifting some kind of weights. You should be doing some kind of core. You should be doing some kind of pressure management. And if you're not, they're missing a lot of those pieces, okay? You don't need only internal work. You don't need only biofeedback and Kegels. You need a lot more of the other stuff. How do I lift my kid? How do I jump? How do I go to this birthday party that has trampolines? You need to be able to do those things with prolapse too, okay? So learning that is really important. The other types of options for treatment, again, because anatomically, we're not lifting the organs. Pelvic therapy, unfortunately, a lot of therapists are out there saying that they'll get rid of like the prolapse completely. That's not exactly what happens. Will you have improvement? Sure. Will it lift a little bit? Maybe. But we can't say that we take prolapse away, because it's actually like the organ dropping in the fascia. We can't change the actual fascia structure. So just remember that. Doesn't mean you're broken. You're not broken. I had to go through a lot of emotional health, like, and mental health and counseling and all of that for my own prolapse journey. I understand. It's heavy. It feels heavy, but you're not broken. And yet there is a life out there where you don't have those symptoms severely and significantly, right? Which is treatment approaches. Pelvic therapy is still gold standard. Make sure you're getting pressure management, strength training, all of the movement that is needed, and also just, again, like behavioral modifications, prevention of constipation. How is my urine flow? Like, how are those things working? And then there's the option for pessary. For those of us that take that advanced training, sometimes we get extra training in learning how to fit, provide, and like order pessaries, and I do that. A pessary is an object that we teach you how to kind of like insert into the vagina, and it helps to lift and hold those organs up so you don't feel those symptoms. Has been a life changer for me. It's been incredible for so many of my clients, because it takes away a lot of those symptoms, and you can wear it with times that you have like, you know, those symptoms. So like, if, for example, I said heavy lifting, sometimes I'll insert my pessary. If we're going on a long hike and I'll have my toddler on my back, I'll insert my pessary. That can be really helpful. Again, I fit those here in St. Petersburg. Secondly, you can talk to your clinician. You're doing pelvic therapy. Pessary is an option. There are options for surgery. A really great pelvic floor therapist is going to be able to tell you these are all the types of surgeries. These are the ones that I recommend for you. These are the pros and cons of each of those options so that you can make an educated decision. Surgery doesn't mean you're broken, doesn't mean you failed. It doesn't mean pelvic therapy failed. I think that's a false perception out there too. Sometimes surgery is what's needed. If that symptom is really limiting your quality of life, you're not intimate with your partner, you're not going out and exercising at all, you're afraid to lift your kids, then of course that's an option. So we want to talk about that and we want to educate you on that. Again, prolapse is something that's really near and dear to my heart. I am here for you. I do virtual all over the world for coaching on prolapse and how to move through it, how to exercise with it, all the emotional work that goes around it too. And also, if you're in St. Petersburg, I do a very thorough 90-minute pelvic organ prolapse assessment to get you the right diagnosis, the right stage, and then we can talk about all of those options for you. But I'd love to know any questions you have. And yes, I hope that we can all live together and answer these questions and have all of these amazing things. You're doing great.